Good evening. I'm going to call this meeting to order, it being 6:30. First of all, I'd like to welcome everybody who's here, and I'd ask for some introductions. And then I'm going to take chair privilege. In the future, I'd like this agenda to also read announcements because I need to tell you an announcement after this. So I'm Frances Anthes, I'm the board chair. Mike?
Michael Parado, present.
Patrick Lowe, present.
Leo Negron Cruz, present.
Okay, thank you, board members. And now staff. Alex
Arriaga, Assistant Commissioner of Health and Human Services.
Tamara Lundy, the Divisional Director of Public Health.
Kyle O'Connor, Tobacco Prevention Specialist, City of Worcester.
Amelia Houghton, Chief of the Nursing Unit.
Okay, and we have our city solicitor.
Alexandra Calcuna, City Solicitor, Law Department.
Thank you, Alexandra. And guests.
I'm Henry Schwallen. I'm a reporter at the Worcester Telegram, which is that.
Thank you, Henry. Would anyone on the Zoom like to identify themselves?
Business Manager. Nikki Nixon, Deputy Director, Division of Public Health.
Thank you. Thank you, Brenda.
Jennifer Nasjoa, Chief of Community Health.
Thank you. Okay, then the announcement. Again, I'm going to ask Brenda to put this on the agenda going forward because I think really I'm supposed to ask your permission to change the agenda to tell you an announcement. But I wanted to let you know that people who've been on the board for a while may remember that Dr. Wayne Altman presented to us back in June about the primary care shortage and the legislative efforts that they are doing in what's called Primary Care for You, which is 3 related bills that they're bringing to Senate and the House this session as the second of the 2-year session. And we, as a board of directors, not only approved their efforts, but we sent a letter which went out in August to the city council asking them to approve that as well. There are some city councils, I believe Boston, Springfield, and Cambridge have already approved it. The city council's subcommittee on public health and human services met at 5:15 today. I was there for their first 45 minutes. They are discussing with Dr. Altman that effort. Seema Dixit, who is the new Commissioner of Health and Human Services, is also at that meeting. And Gary also invited Dr. Hirsch there so that the Board of Health is represented with that, with our concerns about that at that meeting, and the City Council Subcommittee is taking that up. So I just wanted folks to know that. Any questions or comments? Then I would move us right to the minutes of the last meeting. I'm looking for a motion to approve the minutes of the February 18th meeting.
Motion to approve, Madam Chair.
Thank you, Mike. And a second?
Second the motion.
Leo, thank you. We're going to vote now. Mike?
Michael Parado, yes.
Leo?
Leo Negron Cruz, yes.
Patrick?
Patrick Lowe, yes.
And Frances Anthes, yes. So the minutes are approved as written. Next, we're going to move to Amelia's communicable diseases update. And Amelia, it was great to get the report. I read it. I trust we all read it. We have a big agenda tonight. So if you could make it short and sweet, that would be great.
I just want to go over the trends for the diseases, and what I really want to highlight is number 6 on page 8, recent public health nurse outreach efforts, because that's something new that's happening on my team, just to make you aware of it. So, moving right along. Sorry, the microphone wasn't on. Okay, to the chair and to the board, recent trends. This is between February and March. Across the respiratory major viruses, we had influenza. There was an uptick of that, about 31%, and then COVID, we lost 40%. So that went down, which is kind of nice. The rest is as expected. Norovirus, Salmonella decreased a little bit. There was a little bit of Campylobacter. Measles was unchanged. Varicella, there was a case. Travel-related, nothing major happening there. And Strep A, group Strep A went from baseline, from 0 to baseline. Hepatitis B uptick from last month. So all the numbers are there, the chart is there. I don't want to belabor that.
Thank you. It's a helpful way for us to get the information.
Yeah, and if you have questions, we can go over it next time as well. Part 2 was public health recommendations for respiratory illnesses. That's all current, and I mentioned some of the new COVID strains on there as well, and what's happening with those. There's not really anything new there for RSV and for COVID.
Thank you.
The mobile clinics, I added a few more, did a few more shots, and the flu and COVID vaccines that I have are about to expire, so I was just trying to squeeze out the last few, and I might do 1 or 2 more mobile clinics between now and when they actually expire. Spotlight on TB, Part 4, page 6. This just highlights latent TB infection versus active TB infection, which sometimes comes up in the annual reports and people don't know the difference. So this kind of just gives you a little bit of highlights on what the difference is between latent and active TB.
I think that was helpful, and it was also very interesting for me, at least, to see that 80% of the TB comes from the untreated latent TB.
Yeah.
So paying attention makes sense.
Yeah, for sure. Emerging infectious diseases, we know that it's tick and mosquito season coming upon us. So I have the guidance, the strategies, the controls, and the measures here, which when we start the arbovirus reports, I will go over again. So this is
And
just,
how will you inform the general public that it's tick and mosquito season and there are things that people can do?
So once the reporting starts, we have the guidance on our website, and at all of our outreach and outdoor events, we bring education with us. So
Does it make sense to do any, billboards or newspaper ads or any of those kinds? Not that people are all, sorry, Henry, reading a physical paper. But does it make sense to try and do any way in which there's more generic PR?
yes, that's a good idea. So, we'll look into that.
Okay.
I agree with you, because people don't necessarily know tick versus mosquito, what's the difference? So, we'll look into that, getting more education out there that's more accessible. So,
Thank you.
so this is what I wanted to highlight, number 6 on page 8. So this is something that one of the nurses is involved in. So this is in partnership with the Quality of Life Recovery Coach team. So with the team, one of our nurses goes out and they do coordinated outreach. And this is to Worcester residents who are unhoused or underhoused through visits to encampments and community gathering areas. So the outreach activities include person-centered engagement with residents, immediate support, and connection to available services. There's referrals and service coordination there. But what's kind of important right now is we received trust fund support recently in the last few months from the city's trust fund commission, and I was able to put together a budget to buy what we call comfort care packs, and there's a list of hygiene, seasonal items, and first aid supplies, and like hats, gloves, hand warmers, that sort of thing. So they gave us enough money to put these packs together, and so now the nurse is able to take these packs, which are in these big blue knapsack bags, and she's able to give these out to each person she encounters in her outreach efforts. So, and this is important because we have to report back to the Trust Fund Commission, what did we do with your money and what did we do with the supplies? And so it also contains lots of resources, and she is able to meet up with the same people to follow up. What did you like? What didn't you like? What did you use? Did you follow up with this? Can we help you? Do you need help with a phone call? Or did we put too much in it, not enough? Is it too heavy? So that we're in the feedback collection stage.
That sounds great. Maybe we can include tick and mosquito information in that backpack.
Absolutely.
Another question that I have, do we know how many, it was a very bad winter, we know that. Do we know how many people died of exposure, homeless people died this winter?
Not a number I know, but I can get it.
Yeah, I mean, I think it's worth
Yeah.
looking at, particularly as we look at what the shelter situation was or wasn't last winter, and think ahead to next winter. That would be
It was a
helpful.
strong winter, yes, you're right. Okay.
Any comments from my colleagues? Yes,
Madam
Mike.
Chair, I'd like to make a motion concerning the outreach on prevention of tick and mosquito prevention, that the city move forward on that, do the best you can in order to educate the public at large to ensure that they don't contact any of these diseases. Okay, I make that a form of motion, Madam Chair.
Is there a second?
Second.
Thank you, Patrick. We'll take the vote on that unless there's a lot of discussion. Any discussion? Okay, Leo,
Leo Negron Cruz, yes.
Patrick,
Patrick Lowe, yes.
Mike,
Michael Parado, yes.
and Francis Anthes, yes.
And in fact, we haven't spent all the money from that fund, and we're waiting to find out what some of the feedback was so that we can maybe pivot. We don't need the hats anymore and the gloves. Now we need sunscreen and repellent. So this plays into that.
Yeah,
So
and maybe you
thank
can get some, public service free announcements someplace, but,
Yeah,
okay.
Can I make a comment?
Sure.
I've seen some of the blue packs with patients who come into the emergency department, and it's always shocking to see how many people live in our waiting room, especially in the cold nights in the winter. And a lot of people are just looking for both a place to be warm, but a place to wash their hands, go to the bathroom, get their socks and shoes dried. And so some of these comfort, basic hygiene materials really, they change these people's, days and weeks and lives. So thank you to the outreach team who's going through and helping those folks out.
thank you. We do have a pack of what they call shower cloths. So if you don't have water, you can use them to clean yourself
Yeah.
in there. So,
Yeah.
thank you.
Yeah, thank you.
Thank you, Patrick, for the comment, and again, that's good work. Keep it up, Amelia, thank you. Okay, I'm going to move us to the discussions on the policy recommendations. Before we get going, though, I'm going to do a little bit of a background because I know we have one new member, and this has gone on for several months. So within the context of our role as the Board of Health, which is to establish regulations that promote and protect the public's health through data-driven and guidance-based best practices and policies, we first kind of came up with some issues around the tobacco regulations when NMESCO came before us in July. And NMESCO was currently a bar that had talked to Worcester Department of Public Health as early as October in 2024, then resumed again in the spring, and they wanted basically to become a hookah bar as well as a serving bar. And they were seeking an exemption to the 500 density regulation for tobacco retailers and smoking bar. Both of them were within 500 feet of where they were currently. And they came to us on July 7th. They petitioned for the exemption. They admitted that they had put money into restructuring their infrastructure and their ventilation so that they could do this. And we had problems with that because it wasn't according to our regulations. But we also had a number of people on the board who were worried about the business of that organization. And so there were two motions that came out of that. The first was DPH staff was asked to review the current tobacco regulations regarding the 500 density requirements. And the second part of it was a possible differentiation between retail and smoking bar regulations. So we tabled that request. And we also tabled one from Metro Convenience, which was looking for, again, a different sense of what the 500 feet would be. We subsequently learned from the law department that our current regulations did not allow for exemptions. So it was actually good we hadn't done any exemptions because we can't. On August 18th, there was a tobacco hearing again. Nomesco and Metro Gas were back, and the staff reported on the July motions. The staff presented a lot of good, strong, data-driven report on density, on what other cities have done, on the reductions that came about because of density requirements. And the regulations, which were adopted in October 2023, pointed out that places where high density existed also, so we knew from that data that we got from the staff that there were other places where making the density regulations and the caps that were included with density regulations made a difference in terms of outcomes. We also got information that said that a lot of smoking bars have been either declined in the Commonwealth of Massachusetts to be able to exist, so that Worcester, or regulated, and that Worcester actually has half of the state's smoking bars. So that when we talked about the difference between the retailers and the smoking bars, the retailers, our staff told us, were basically about easy access, but the smoking bars were really about a socially acceptable environment in which smoking was okay. And the smoking bars was also the place where there could be an exception to the state ban on flavored tobacco. Both some state and local experts spoke to us in addition to our own staff. There was a concern expressed by the state about secondhand smoke and said that was one of the reasons why they were not particularly supportive of smoking bars. They reminded us that many Massachusetts cities and towns, probably about half the people served in Massachusetts, are in a city or town where there is a cap. They also said that density regulations existed in other cities and towns. And may mention that Boston is phasing out smoking bars over a period of time. So the information that we got on the state basis kind of put Worcester in a different category than most of what we were seeing in other places. We had two folks come from UMass Memorial Healthcare to address it, Dr. Joe DeFranza, who is considered a national expert on adolescent tobacco use. He was quite concerned about the amount of nicotine in a hookah bowl was equal to the amount of nicotine in a package of cigarettes. And he was, as an adolescent addiction specialist, he was very worried because smoking cigarettes is about the same level of addiction as participating in hookah bars, except that hookah bars may be a place where youth are more likely to try it. And I want to recognize that the hookah bar we're talking about is people over age 21, but that was the information that we got. And he was concerned that businesses were profiting from addicting people who weren't informed because there wasn't as much information about hookah bars as there were about cigarettes in general. We also heard from Dr. Carolyn Crass, who was concerned that the Worcester percentage of tobacco use is higher than the state average, and we also have higher asthma and lung cancer rates. And she was saying that the accessibility strongly influences whether youth use. Nemasco presented to us that very same day. They had a lot of people here, you may remember, who worked at Nemasco, and they were very concerned about the loss of employee jobs. They felt like they would have to go out of business unless they had another income stream. And they were well within, well, they wanted us to know how much they were in compliance with city regs, and saw themselves as part of Worcester's economic development. The Chamber of Commerce also supported them in that. There was a letter of support from the mayor. There was a letter of support from the vice chair. And Nemasco basically said they only are open to people who are over 21. They do have, or would have, an ID scanning system, and the only way to sustain their business was basically to move forward with that. Dr. Hirsch, as our medical director, spoke to us about all the number of chemicals in the hookah smoke, 300 chemicals with a higher concentration level and higher rates of COPD and cancers. It's comparable to the risks of smoking, was his message, and cautioned us. Massachusetts currently spends $5.5 billion on smoking illnesses every year, and he thought this was not a wise use of our funds. Dr. Castile, who was still here as our Commissioner of Health and Human Services, I think it was her last meeting, mentioned that the cost of the city's healthcare system and the health of the community were her big concerns. And then, as I mentioned, the Worcester Chamber of Commerce was here, and they very much wanted to support both the vendor and the city's new goal of being an 18-hour activity place, which would basically mean that we weren't just kind of working here from 9 to 5, but we were also having entertainment and things going on at night. The board at that point voted 3-2 to deny the waiver for Nemasco. And then Metro Gas made their presentation, and they basically said they would hold off on making their request for an exemption because they wanted to see what we came up with in terms of the staff coming up with regulations to differentiate between retail and smoking bars. And so the board voted 5-1 to ask Worcester Public Health to look into whether there should be a delineation in the regulations between smoking bars and retail establishments. So that's what we asked for. That's why we asked for that, and that's where we are today. In the meantime, in the February meeting, Alex was here, 2 Alexes, sorry. And she presented some preliminary recommendations which would align all of the tobacco regulations that we have going back to, I think, 2016, 2018, 2023, and 2023, to align those, to make it clearer. And I think everybody is thinking clarity for the vendors would be helpful. And so some of what we saw in February was in that area, but we got that kind of plan right at the meeting, and we agreed that we needed staff to, we needed members to be able to have time to look at it. So with some confusion about which version we were working on, because there was a lot of work being done by a lot of different people, we received on Friday evening the version that we're going to look at today. And I leave that to one of the Alexes, or Tamara, or Kyle, to explain kind of what we're thinking right now as should be the new regulations.
Sure, thank you, Madam Chair. And thank you for that opener. We will be picking up where we left off in the last board meeting, where Alexandra had a chance to present some of the changes as a request from the board, bringing back mock changes of that version of the document so that you're able to see exactly what changes have taken place. So Kyle will be walking us through those changes. Kyle?
Thank you, Tamara, to the chair, to the board. I think the easiest way to go about this, there's about 10 major changes that I want to discuss with you folks. I think we can go through each one. I can point out where exactly the change is happening, give the reasoning and justification. And if there's discussion and questions, we can have that then, and then I can move on to the next one, just to keep it clear.
Okay?
Okay, so the first one is just page 1. It's the updated statement of purpose with up-to-date statistics on the consequences of smoking and tobacco use. By updating the statement of purpose with current data, it ensures the regulation reflects the latest public health evidence, strengthens its justification, and supports legal defensibility. The only thing I want to note for page 1 is that the state template often has the sources where they got that information from, but that easily can be added for the next version.
Kyle, I have one question about all the whereases. I noticed that when I look at the 2023, we dropped item number 5 on the 2023 one, which says tobacco retailers are more prevalent in underserved communities, especially in neighborhoods with a higher proportion of African American or Hispanic residents. That one was dropped, and I'm wondering if there's any reason. I'm kind of a real fan of social determinants of health, so I like it in, but I wondered if there was a reason why we took it out.
I was unaware of that drop, so I can look into that. If that was an error, we can simply add that back in.
Okay, great, thank you. Any other questions on the first page from members of the board?
Good.
Okay, thanks, Kyle.
Okay, so this next topic is at the bottom of page 1 and at the top of page 2. It discusses consolidating the previous tobacco regulations, which includes the Board of Health regulations related to restricting the sale of tobacco products, which took effect in September 1st, 2016, restricting the sale of cigars and flavored tobacco products, which took effect January 1st, 2019, and restricting the number of tobacco product sales permits that took effect in October of 2023. So repealing the outdated regulations and consolidating them into a single updated regulation, like you said, Fran, it improves both efficiency and clarity, and it creates more of a streamlined framework that's easier for staff to administer and enforce, while also making it simpler for retailers to understand their responsibilities and remain in compliance.
Okay, sounds good. Any?
Later in the document, I think in this definition of retail tobacco store and smoking bar, later in the document, there are two different other terms. On-premises tobacco product sales permit, I'm referring to smoking bar. Can that be kind of clarified in the definition? When, because that's, I mean, later, it's put in parentheses smoking bar, but I think in definitions should be clarified. And the same for retail tobacco product sales permit, which is, that's in there, but the smoking bar, I think then it could lead to confusion.
Yeah, so just for clarity, so in the definition section at the bottom, there's a definition for smoking bar. Just want to clarify, it would be helpful to include that it's on-premise tobacco sales permit. That way it's reflected later in the document. Is that what you mean, Leo?
I think to go off the same one, later on we often just refer to it as on-premise consumption or something like that, whereas that's not specified in the definitions here, but smoking bar is. So I think it'd be easier to use one or the other consistently. I did find that there's also like the tobacco sales permit was capitalized as an item, seemed to be something that we should all know what it is, but it's not in the definitions here. So there were a few inconsistencies on just those wordings that I think would be helpful if we're going to define those things. To Leon's point, it'd be nice to just keep that consistent elsewhere. Those two stuck out to me.
Yes, we can clarify that a retail tobacco product sales permit means general retail stores, and then an on-premise tobacco retail sales permit means smoking bar, and those are the colloquial kind of nicknames. We'll make sure that the official definition is consistent throughout.
And if I may, I think the last thing that you had said in terms of your presentation was most important, to me at least, is making these regulations easy to follow for businesses so that we accomplish the whole public health point of these regulations, which is to, for example, not sell cigarettes to kids or not be selling, illegal products out there that we've banned or the state has banned, and to follow the rules. And easy to follow rules is an easier way to follow the rules. So I just want to make that, the consistency in language. All of this might seem a little nitpicky, but I think it's important for businesses to know what are they, what are the rules, how can I easily read this document, for the public to be able to follow them. So thank you for that.
All right, thank you. I'll move on to the next one if there's no more questions about that. Okay, so section B, which is the tobacco sales persons under the minimum legal age are prohibited. In that section, I'm specifically referencing number 3, the required signage. So revising the signage requirements section to remove outdated language and incorporate language clarifying that all retailers must comply with the applicable local and state signage requirements. This update removes signage language that is not being enforced and instead incorporates a broader language requiring compliance with all applicable state and local signage laws. This approach ensures that any future state-mandated signage requirements are automatically covered, reducing the need for ongoing regulatory updates.
Okay, any concerns about that? Thank you, Kyle.
Okay, the next one is section C, number 9. So in this area, we are updating language reflecting that flavored tobacco products are prohibited from being sold or distributed, except in smoking bars for on-site consumption only. This reflects state law that went into effect in 2021, banning flavored tobacco products from any establishment in Massachusetts except for smoking bars.
You went right to 9, Kyle. And I'm wondering about retail tobacco permit requirements under E, which is number 1.
Madam Chair, what page are you on?
Sorry, I might.
I'm sorry. I went to 6 instead of 7.
Section C, number 9.
Right, sorry.
All good.
Totally my fault.
Would you like me to read it again for clarity?
Yep.
Okay.
That section, I think you're repeating a phrase as defined herein. It's twice. Probably that's it. I don't know if that means anything.
Yeah, I got it.
Friendly amendment.
Friendly.
What is it? I didn't hear that.
The phrase in the point 9, it says on the second line, as defined herein, comma, as defined herein, except smoking.
Want to reinstate that even?
Yeah.
It's really well defined.
Really
herein.
defined.
I want to make sure they
Thank you for pointing that out. We'll make sure that is deleted. But Fran, just for clarity, we're just removing the adult-only retail tobacco stores section to reflect state law that went in place in 2021.
Sounds good.
Any questions on that, or? I can provide clarity if,
So are you on E now?
no.
You're still- okay.
Section
Yeah.
C, number 9.
I
was-
think
What page are you on, Kyle?
I think we're okay on C.
Page is 5, page 5. I didn't know if you had
Slow
any
down,
questions.
Kyle. Okay, slow down.
Getting ahead of
Are
myself.
you okay, Mike?
No. He's flying through this. This is very important. Thank you, Madam Chair.
Okay, I think we finished C, unless there are questions. Or unless somebody stapled the pages wrong, as I did. Okay, Mike?
I'm good. Yeah.
Okay. So we're now DE, I think.
So actually, the next proposed section is section E, number 1. So updating the retail tobacco permit requirements to reflect enforceable policies that hold retailers accountable to understanding state and local tobacco regulations, and for ensuring that their employees receive appropriate training and education. So removing this language and adding, clarifying language requires that retailers maintain detailed records and signed acknowledgments for all their employees who sell tobacco products and keep that on file for the Board of Health. However, this requirement is not practical to monitor or consistently enforced. Instead, the focus is to establish clear expectations for retailer responsibility and compliance rather than burdensome documentation requirements.
So you want to take out the second paragraph that's in red, so it got put in and now it got taken out. Because there's no way for you to enforce that everybody's got a signed thing in somebody's personnel files. How do we know? We don't know whether the training is happening, but maybe that's not enforceable either. How easy is it to get those regulations? In other words, we want to provide as much training and education as we can. Do you have to go to 4 different websites? Do you say you want a tobacco license and you say, oh, here is a copy of the regs? How does that work?
Yeah, that's a great question. So with every retail education visit, one is done each year, especially if there's any new updated regulations, or if there's a new owner, a new store, or simply they just want a reminder or a refresher on regulations. Each time I do that kind of visit, they're given a copy of both the state and local regulations, as well as a postcard given to me from the state that has a QR code that provides free training in both English and Spanish for all employees. So that is also something I emphasize to the retailer on each visit, is that as the owner, it's their responsibility to ensure that all of their employees know all these regulations and follow them accordingly.
Would it make sense to put that in this reg? I mean, I think that's really good. And I'm wondering if it makes sense to put that in because, again, we would like the regulations to reflect the education that we're trying to do. Is that okay? Or a possibility?
I think that's something that can be added as something that's done in enforcement to ensure that all retailers have copies of these. And to address your other question is that these are all as well on our website and easily accessible there as well.
Okay.
Yeah. I mean, the first bullet point that has been now taken out that was previously in here basically said what you just described, that we would provide them at the time of their application or their issuance of their license with the permit. They would also get a copy of the regulations and the applicable ordinances. So that language is already present and could be just reinstated. It does have a point where the applicant must sign a statement declaring that they've received those things, which I don't think is burdensome. And they're filling out a piece of paper they can sign that they said they did receive it as well, which I think is relevant to this discussion. If we're going to change things, people need to acknowledge that they've received the changes that are out there, so we can make sure that people are able to follow them appropriately. I think that first one that was stricken is able to be kind of just put right back in fairly simply, especially if you're doing this annually at these visits. I think to me at least, that doesn't sound like much more burden on top of it. But it is stronger than saying these people shall familiarize with something on a website that, I couldn't find it. The website was down that day. I didn't know that was a rule. I mean, this is just a little bit more enforceable and a little onus on us to make sure they know, what rules they're signing up for.
So if I may, Dr. Lowe, are you saying that we are going to require retailers to have copies of the updated ordinances, most recent copy,
I think
on premise, and also have the employees sign? I think the signature part is the one when we do inspections is the harder part, considering these stores which are kind of, diverse and language may be a barrier and all of that. But I think having them copies on premise is something we can definitely check. What do you think, Kyle? Because I want to make sure we are able to implement it as well. Is that what you're willing?
Yeah, I didn't get to that point yet because
Okay.
It's so hard with all the copies that we have to refer and make sure everyone knows. Okay, so the first paragraph of what we are looking at that's edited, I have the original language from the last edition. There were two paragraphs. The first one just dealt with the permittee, the person applying for the permit and getting it. And it basically said that at the time of application, they would get a copy of the regs and the ordinances, and they would sign off saying, I received the regs and ordinances. Paragraph 2, which I think is displayed in this document and is struck out in red, is more about the employees signing on and saying they also, received some training or something. I wasn't talking yet about that, just the first part. The person applying for the permit would then say, I got the ordinances, I got the regulations, I agree to follow them, I've signed off saying I got them.
So it's the vendors you're referring to currently,
The,
right? The vendors,
the person who's applying for the permit to sell would,
understood.
and that would just be on us to make sure they get it, rather than saying, make sure you go to the website and familiarize yourself with whatever's out there floating on the internet. We're just handing them a copy, and it sounds like you do that at your annual checks anyway, so.
I can also add as well, so we use OpenGov for permitting renewals and all applications for tobacco. I believe we can contact someone who helps us run that site on the Worcester end of it, and add in a stipulation saying by submitting this application, you are agreeing that you have read and understood the regulations in its entirety.
Seems straightforward enough. Then they're provided with it, and they've signed off saying, agreeing that we have indeed received this information.
And I love that you're doing an educational visit annually. I mean, I was not aware of that, but I'm really glad to hear it, because I think that's one of the things that we're trying to do, to kind of keep up the communication between the vendors and the department. That's great.
Ongoing with updates.
Yeah.
Agreed, very much.
Okay, so we're set on the idea behind the first paragraph. The second paragraph, which was put in and then taken out, are there any comments on that, or are we okay with that? That's not the vendor, that's the employee. And we took it out because we didn't think we could monitor it. Okay? Is that?
What do you think?
Go ahead, Mike, if you want. Could I ask a question?
Yes.
Is there anything that other municipalities or communities do in this field that's maybe something that we could do more practically? I mean, ServSafe is something that every, bartender in the city has to go through, and everyone in the state's doing that. I don't know if there's something similar, if there's any sort of educational requirements elsewhere in other municipalities that we could look to.
I'm aware of the state providing that free training for all employees. It's not mandated like it is with ServSafe. That is something that they're currently updating. They're trying to expand it. It's the videos and questions and quizzes that link to that postcard are, I think, like 5 or 10 years old. So they're currently updating it right now to have all current QR codes and anything that was handed out previously linked to the new and updated education. Like I said, it's not mandatory at the moment. That could be something the board wants to include in these regulations, is that when I do hand out that postcard and regulations on the educational visit or for a new store, new owner, is that the retailer agrees that all of their employees will go through that training. I'm not sure if that's something
Madam Chair, that's something that I would definitely support, okay? So I would appreciate if you could find some type of language that you could put within this document that would support that.
I think the other piece of that is that when people come before us to grieve what has happened, they often say, oh yeah, well, everybody's trained except for that one person, or that one person didn't do it right, or that one person forgot, or something like that. And this kind of puts out there that we expect everybody to be trained. Thank you.
Did you want to say something? No. I was going to ask about that. In the past, has this been something that's inspected? Like when there is a violation that occurs, do you ask for the documentation that the person or the whole staff have signed on according to our old regulations to say that they did indeed receive any training or instruction from the owner or the permittee?
No, that training, that piece was never enforced. Upon each violation, if the retailer wanted to appear before the board, I think the board they had that right to request that information, but I don't believe that the board ever requested documentation for anything like that. And it was never something that I used to emphasize as part of my retail education visits. There's a lot of regulations, so we usually hit on kind of the major ones that I see more frequently. Mm-hmm. So that was something that was a bit overlooked and not enforced heavily. So in order to be consistent going forward, I think it would be helpful to have that either requirement that the retailers provide that education, or it's something that isn't included at all, just to keep these regulations enforceable.
I have a process question for the chair, or I guess for the board at this point. I mean, if we're going to consider some sort of moving forward with the document, I would motion to reinstate the 2 paragraphs that were there, waiting for perhaps what Mr. Parada had asked for, to include something if there was something available in terms of training from the state. I think at least having people sign to say, yes, we did provide this training to our employees, even if you're not inspecting that regularly and enforcing it regularly, if it came up at a hearing in the future, I think we should have some way of defending the employees who are being blamed by a permittee, saying, well, that one person, I did the training. Well, I mean, show us that evidence that at least the individual did sign off on having received some training. I don't think that's a bad thing to have in place.
Make the motion.
While we wait for something else. So
I'll support it. Make the motion.
Before I do the motion, I want to ask Madam Chair, should we do it? What's your thought on the process of editing the document here.
Through the
5.
chair, can I make a suggestion? You can, and I don't know what the previous language was, but you can require that the retailer, the owner of the establishment, have all employees sign off that they've read I don't know if you want to do a specific training or just say that they've reviewed and received the local regulations, the state regulations, and that sign off can be kept at the retail establishment so that when there is an inspection, the DPH agent goes in and then they can say, well, can I have your certification that you received the regulations and that, you were properly trained? They wouldn't have to submit that to DPH or the board, but that should be kept on premises. And it's frequently done with other liquor establishments. You have a responsibility to train your employees.
May I make another suggestion as well? I believe if we did implement a step in the OpenGov permitting and renewal process, during that process, you can have one of the retailers agree that they've reviewed and trained all their employees on these, regulations and ordinances. And then that way, when their permit is renewed or submitted, that permit acts as the burden of proof that they submitted that. It's very difficult in the field during enforcement to have all the retailers have all copies of DORs, all copies of state and local permits. So adding another item to keep track of it would be difficult for retailers to kind of catch up to that and to be consistent throughout. And then I would have to consider what enforcement penalty that I would have to give them for not having that list, and that could also lead into some equity issues if it's not consistent throughout. So just wanted to put out there as well.
So how frequently is a renewal?
Every year for the city.
So basically, if we put something in here that says everybody's got to be trained, and you can kind of play with the words on that, I think, according to the people on the board, you would be, and if you added it to the renewal piece, there would be a check-off box on the renewal that said that happened. Would that?
I'm happy with that, Madam Chair.
Okay with that?
To the chair, agree 100%. The idea is that we're not having individual employees take onus of this. That employer, when they employ someone, they are saying that they will train that person. So by doing that, we remove all of this, maybe that. You have signed off saying that you are owning this. You will train each of your employees on these regulations. That makes it a lot simpler, easier to enforce, and there's less of that I didn't know, or that person wasn't trained well.
I don't disagree with that, and I want that onus to be on the applicant for the permit, but I do want there to be some accountability. So if they're the one who's going to come here and speak at the hearing alone, or with a lawyer or some representation, and say, hey, let us go of the fine or the whatever, but the employee is not going to be here to say, hey, he never trained me. He gave me the keys to the store and told me to lock up when I was done. I never got training, but obviously the permittee is going to check it off and might say that. So I think there is a little bit of accountability here. I would say that checkbox idea is excellent. I would put in there that maybe in there as a reminder, the regulation says that all of your employees are required to sign off, and you're required to keep a record at your premises that they've received training and have been advised of these regulations and ordinances. I know it's probably a challenge, and it's probably hard for them to keep track of all their permits, but I don't think this is not an important issue. I think this is something that we should push businesses to be accountable for. That's kind of my stance on it. Alexander, I'm sorry. The language that you basically said is what was in there before, and I have it written here if we want to move it, or I can give this to somebody afterwards, but if we're making motions and edits, I would make the motion to reinstate those 2 points, and I can read the text or provide it, or however we best do it, Madam Chair.
Okay. I'm not sure that we need motions because we've already given you a number of things to fix, as it were. So what I would suggest, if it's agreeable to my colleagues here, and I'm looking at all of you, let's give Kyle what we want and give him a chance to make those corrections and bring it back to us. Is that okay?
I'd support that.
Is that, Patrick, okay? Well,
Yeah.
I've been really impressed, Kyle, with your work so far, and also your ability to hear us even so far tonight. And so I think that we probably will complicate things if we put everything in form of motion, and I would just suggest we give you our thoughts, and you get to bring it back to us, if that's okay.
That's good.
Yes, thank you.
Alex, does that work for you? Okay.
So just for clarity on the last point, so are we, Pat, did you say you wanted to keep what was already stated, is that the retailer must sign something as well as all of their employees and to keep that on file? Or are you saying to have something in OpenGov step saying that retailers are responsible for all of their employees, and then it's on them to train them on all these ordinances and regulations?
Yeah, so the prior language says both of those things. In part one, it says that the permittee is signing off to be both that they receive the info and that they're taking responsibility for instructing all employees engaged in tobacco sales, blah, blah, blah. And then item number 2 said, no permit holder shall allow an employee to sell products until they've acknowledged in writing receipt of the regulations, a copy of which is on file at their site and can be made available to the Board of Health upon request. So it's kind of a little bit of both. And I would just say, yeah, to the flexibility point that was mentioned, if the state already has something rolled out that's educational, and I would be totally on board with saying that all people selling tobacco have to go under some education to make sure they're not selling, cigarettes to kids. If there's something available that we can do quick and easy that's free for the city and free for the businesses to do this and implement, I would say go for it. Short of that, I would say keeping this piece in here is what I would request.
Okay. I think there would just need to be some thought put behind enforcement in terms of when you would start penalizing retailers who can't provide this information. It would just take a good amount of time for all retailers to kind of get to that point, especially with language barriers and technology issues.
Might be one of those things that never comes up unless there's a problem. Do you know what I mean? Like if you're citing someone, you go into the store and you say, so did everybody sign off? And then, well, maybe, in other words, it becomes part of the problem rather than it's something you have to monitor on an ongoing basis.
I agree. Not to let the public know we're not going to keep you accountable for it, but it would be something that would be better if we were just saying later on, and you're getting a citation, you want to appeal it. Well, did you follow these steps along the way as well? And I think it's something that is not too burdensome, and that is the policy now, right?
It is.
We face the same issue that you're pointing out now, and we've been getting by. So I would just say we should keep doing that until we get something better.
Gotcha.
And I think in the document later on, page 9, at the bottom, it says for all other violations specific to the Worcester Board of Health regulations, this would be under that.
Yeah.
This would be a Board of Health regulation rather than
It
state
would
law.
technically, yeah, exactly.
Yeah.
Correct.
Okay, I can move on to the next one now. So this is in reference to section F. This pertains to number 1A as well as 3D. It's regarding density. So language was added to help differentiate and regulate retail tobacco product sales permits and on-premise tobacco sales permit, also known as smoking bars. This regulation states that no new retail tobacco permit sales permit shall be issued within 500 feet of another retail product tobacco sales permit or school, and that any new on-premise tobacco sales permit shall not be issued within 500 feet of a retail tobacco product sales permit or a school. Therefore, this would eliminate the 500-foot distance policy between smoking bars. This change reflects how the Board of Health wanted to regulate these two different types of tobacco permits differently. However, I think we noted right before the meeting that the language is somewhat unclear, specifically in section F, number 3D, the density part. I believe this is a error. It shouldn't include the language retail tobacco product sales permit, as this regulation was proposed to just have smoking bars be regulated separately, allowing smoking bars to be within 500 feet of each other and other retail establishments.
I've got 2 questions. First of all, I'm not sure that I quite understand what we're saying here, but my second question is, do educational private elementary or secondary include daycare or not?
I do not believe so. I would have to double check on that, but I don't think so. It includes just primary
So
school.
my second question is, should they? And if they should, how complicated does that make it? In other words, you may have a bunch of things which just became more complicated because there's more daycares than schools or something like that. But can you do some checking on daycares and what other municipalities have done? Because if we're really trying to keep smoking away from kids, we're trying to keep them away from little kids too.
I believe, Fran, if I may just add to that, I think not all daycares are registered. I don't
Right.
believe.
Like a family daycare is not
Right,
registered.
Right. And I think I haven't delved into national and other state local tobacco practices in a long time, but I remember when this had come up many, many years ago, it was more the secondhand smoke exposure that was a concern with daycares, not so much the sale, because the youth initiation was 13, 12, 9, and I think the registration piece. But it won't hurt, Kyle, to check if anybody is including that, because we've always talked about after-school programs or like bus shelters, which cater to school kids and schools, not so much daycares, but yeah.
Yeah, and there's clearly a difference between, I mean, you could be a licensed daycare provider who only has 3 kids in your house with your own kid, or you can be a group daycare provider that has 200 kids. And so there may be some differentiation even among that when people look at it.
Madam Chair? So, in looking at this, we were exploring the possibility, okay? We've talked about where you have a smoking establishment and then you have a retail establishment, okay? Which is, in the example I'm going to use, was the people that were here, okay? You have a cigar bar across the street from a retail establishment that wants to sell cigarettes in order for them to be successful, if I remember what was happening. So what you're saying here, you're not recommending that at all within this?
No, I'm saying that what you just said is reflected in this regulation.
Is what?
Is reflected in this regulation. So if a general retailer wanted to open within 500 feet of a smoking bar, they would be permitted to under this proposed regulation.
Okay. Thank you for the
Which I think
clarification.
that's the differentiation that we wanted to have
Right.
was retail
Right.
places versus smoking bar, that 500 feet was not applicable. And that's the case of the gas station.
Yeah.
That they was within 500 feet of a smoking bar. Then we needed to deny that because
Right.
now this is allowing for that to happen.
Correct.
Thank you, Kyle.
So F1A, or was that where we are?
It's F1A and F3D. They both discuss density just in terms of general retailers versus smoking bars.
Okay. So what I think I understand or understood when I was reading it is for the example that we gave of somebody who came here, wants to open retail, and there are 2 smoking bars in the neighborhood within 500 feet, his answer would be yes, because we're saying you can do a retail with 2 smoking bars within 500 feet. What's the reverse of that? So the smoking bar who wants to open up next door to another smoking bar, we would say that's fine. But what about the retail 2 doors down?
So it would be vice versa. So the smoking bar would be allowed to open next to the smoking bar, but the smoking bar would not be allowed to open next to the general retailer.
That's not what this says.
That's inaccurate.
This document puts 500 feet between stores and 500 feet between smoking bars, irrespective of stores. So you could have a hookah bar, 500 feet away another hookah bar, and in between them you could have a cigarette store. But you can't have 2 hookah bars standing next to each other, based on what you said would be edited in the 3D. Is that right? The distances between the similar businesses.
Yes, so general retailer, in this regulation as it stands right now, a general retailer cannot open within 500 feet of another general retailer or a school. A smoking bar would be allowed to open within 500 feet of another smoking bar and a general retailer.
It's not how I read it, but if that's the case, then I would like.
I think we
not do
could
that.
provide some clarity or clean up the
Yeah,
language to reflect that.
you-
So could you just state what you want to be reflected in this regulation? That way I can,
Or what you were expecting.
yes.
So, if I may, 3D should be edited on the second line. It should say within 500 feet of an existing on-premises tobacco product sales permit, or whatever language we're going to choose for the smoking bar. because this is saying that new on-premises tobacco sales permits shall not be within 500 feet of an existing on-premises tobacco sales product store or permit. Meaning, you can't have two hookah bars next to each other. We would need them to be 500 feet separated. I believe what you said in your opener was that was maybe an oversight in that point, and that was what it was intended to say. And I would support that idea. And I think the edit of changing that second line from retail to on-premises fixes the issue.
Okay, so just
I don't know if the whole board agrees. I'm just saying that.
I want to hear a clarification on that. I think I agree with you, Doc, but I want to hear what it is. Go ahead.
So I can clarify what I think Dr. Lowe is trying to say is that I will change 3D to say a new on-premise tobacco product sales permit, a smoking bar, shall not be issued within 500 feet of another on-premise tobacco product sales permit, smoking bar. Is that what you're?
I would support that.
What about retail? That's what I'm concerned about the most, okay?
So the retail to retail is on the previous page,
Yeah.
section F, number 1, letter A, which states a general retail permit cannot be within 500 feet of another general retail permit or school.
Right, okay. But let's just go back to, so the question is, if someone wants to have retail, okay, sell cigarettes on the gas station, okay, and they're within 500 feet of the smoking bar, they would be allowed to get that permit?
Yes.
Okay, and I'll support that, and I'll support Doctor's motion too, okay?
Okay, so let's make sure we're all on the same page.
Can you repeat what we just talked about? Can you just say again?
Would you like me to say again?
Yes.
Sure, okay. The way I'm understanding this, okay, is that the situation came up where we had a gas station that wants to open, okay, and they want to sell cigarettes. And it's within 500 feet of a smoking bar, okay? And what we're trying to do is differentiate between retail and the smoking bar. So what Kyle has told me is that because one's a smoking bar, the other one's retail, that they would be able to get the permit. Okay. But what the doctors interrupt me if I'm wrong, what you're saying, you don't want, and I would support this, two hookah bars within 500 feet of each other. Is that correct?
Correct. The same way we wouldn't want two convenience stores next to each other selling cigarettes either.
Okay.
So it would maintain a 500-foot buffer between similar types of establishments. The hookah bar is 500 feet buffer, and then the
Go ahead.
retail tobacco product sale permit within 500 feet of each other.
Of each other. Okay.
So if I may, and everybody from HHS, feel free to correct me, because we've gone over this so many times that I may misspeak. The way we have framed this document based on our discussions was retail to retail, 500 required, retail to youth congregation school, 500 required, smoking bar to retail, 500 feet not required anymore, smoking bar to smoking bar, 500 feet not required anymore, understanding and knowing that smoking bars do not allow anybody under the age of 21 to even enter on retail. Our whole purpose is to not have youth to initiate because the age is decreasing and all of that science and data behind it. So we have this document, and there may be typos, and I don't want to put Kyle on this part, which we already are, so it's not his fault because multiple versions were being circulated. But that was the intent of this, is retail to retail, we want to keep it intact. Retail to schools, we want to keep it intact. Smoking bar to retail, we want to remove the 500. And smoking bar to smoking bar, we want to remove the 500. Please know, currently, my understanding is 15 smoking bars are allowed to operate in the city of Worcester. We are already at 13. So we are talking about 2 other places if they want to open. So as we looked at everything based on where youth are allowed to go in, 21 and above, signage, all of that, we deemed, and that's why we put this in for your consideration to remove that as well. Did I confuse you more, or?
No,
but
I disagree.
No, I think what the board has said is actually, what we have discussed here, is to keep the 500 feet between the on-premises tobacco product sales from smoking bar to smoking bar, smoking bar to hookah, to be 500 feet. That's, I think, what we are saying that we want, or at least I'm saying. that I want.
So-
And then is the only 500 feet removal was between the two different kind of establishments, the smoking bar and this
Retail.
Retail. That's the only, the other 500 feet from schools, we want that, and but we want to keep 500 for the same type of establishments. Hookah bars and smoking bars should be 500 feet apart. And smoking, retail, 500 feet apart, but retail and smoking bar should have no regulation.
Understood, understood.
A buffer zone. Of
Understood.
sort.
May I ask you, go ahead, Fran.
So I actually have heard two different things. So I hear now that we're saying 500 feet between the same kind of animal, right?
Is
So-
I think what you're suggesting.
Right, that's what at least
Yeah.
two members of the board are saying
Yeah.
that. And 500 feet for both animals and schools, right? So you can't have a smoking bar near a school, and you can't have a retail near a school.
Correct.
Okay. I think, though, that the new selling in the convenience store with the smoking bars being nearby, we said okay. So what's the reverse of that? If you want to put a smoking bar in, can you be close to a already established retail? That would be yes, right?
Yeah.
Yes.
Okay, so,
I guess if I may, hopefully I don't add to the confusion, but I have a question. I've never smoked, but sometimes you need a smoke, it seems like, with all the nuances. If I may ask you, your understanding or your reasoning behind smoking bar to smoking bar requiring 500 feet. I'm just trying to understand.
Well, I think this is a question we should all ask about all of this, because the whole point of this is for the purpose of public health. So it shouldn't just be we're making this decision without that in mind. So I really appreciate asking the question. I would point us to the map that was provided, and hopefully that's something that's available to anybody, and to consider the concentration and the density of where these businesses tend to be located. There's similar, I think, in our whereases, although maybe it was the one that our chair mentioned was cut, I forget. The density of smoke sale locations is often associated with people on the margins of our society, people in poverty, people of color, immigrant communities, people who rent and don't own. These maps, which this isn't the one I was specifically referring to, but you can look at any of the maps that were provided for the distribution of our city. They're not in like Tatnook and in the neighborhoods on the east side either. They're in these like major thoroughfares that also happen to be major areas of density of people who are living in poverty, immigrant communities, non-English speaking populations in our city. I don't want to see a whole strip in Main South of hookah bar after hookah bar after hookah bar. And although there's only 2 permits left to give out now, that's a dynamic thing. Any one of these businesses could go under, the permit could be up for grabs, this could change over time. And so in my mind, it's not a problem for today necessarily, but it's a problem for the future. And they could concentrate in neighborhoods in a way that we don't want to see, and businesses may not want to see it either. I mean, I don't want Shrewsbury Street to be one long hookah bar location either. There's already, I think, 3 located on the street. So I would, for that reason, for the density argument, not for the youth initiation as much, although that comes into play as well, I would say that's my rationale, and it kind of transcends both of the establishment types, and I'd rather not have all of them next to each other.
Thank you, thank you. And I think our thought process was, again, this is a draft, we're not voting on it, was much as we are looking at density, clearly, I'm very familiar with that, we are also looking at letting businesses be there in that strip where businesses are not thriving. That was one thought process. I completely agree with you. We don't want to have a line of hookah bars. And our best bet was, the way we thought was, just because we want businesses, we are not going to put them next to school. We are not going to put 2 retails next to each other. That is a complete no-no, right? Because we do know that leads to youth initiation at a very young age. But we felt 2 hookah bars next to each other with a very small margin of 1 or 2 businesses opening was marginally less risky as compared to letting a retail open. And I'm just putting it out there, the discussions that we had, back at HHS to think this through. So it's not like I don't agree with your map or the map that we have here at all completely, but that was the thought process, is something about balancing the business while mitigating the harm as much as we can with the youth, subpopulation. So I just wanted to explain it because I don't want you all to feel like we did not hear what was said last time. But
So, I see clear consensus between the gentleman to my right, that it's 500 feet between smoking bar. Mike, where are you at with that?
I'm good.
Okay, so I think that the board is saying, it's like apples and oranges. There's rules for the oranges and there's rules for the apples. And the 500 feet is because of the separation between the similar kinds of facility. And that's what that's what we're agreeing to as a
Okay.
board. Okay.
all right. Somebody's noting.
Yeah, I'll make sure to reflect that in the next version that you receive.
You're taking notes, right? So
Yes.
we can go back. Thank you.
All right, so moving on. to
Sorry,
the-
before you do,
Sorry.
can we address two other sections of this? I think we skimmed over 1B, which was
That was my next one.
I'm
Because
sorry,
we were
okay.
talking about density, I figured grouping them together
section
would
did
make
D. Yeah,
sense.
fine.
Yes.
All right, let's go there then.
So
if
that
you don't
is
mind.
the next section. So section F, number 1, letter B, the exemptions. So language was added to allow locations that have been previously held a retail tobacco product sales permit within the past 5 years to be exempt from the 500-foot density policy until the cap of 235 retailers was reached. This change reflects the city's attempt to balance economic stability and provide the opportunity for previously licensed locations to reopen after temporary closures due to financial hardship, renovations, or ownership changes. This also reflects the discussions from previous meetings asking DPH to look into exemptions, and this being one of the ways to go about them, giving flexibility for small businesses while still maintaining the overall cap. Considering other policies of exemptions, we concluded that exemptions weren't in the best practice, so this would probably be the one caveat of that, as it would lead to possible equity and consistent enforcement issues. So, yeah, that's that one.
So I know there's some questions about this one.
Just to with what Ms. Dixit brought us to before, what's the rationale, or do we have anybody left in the room who remembers that for 235 being a number of as the cap that we selected?
Yes, so in late October, October 2023 was when the density regulations were put in place, including the cap. It was put in there, 235 was put in there considering that there was applications pending. So 235 is likely where the total amount was at the end of 2023. Mm-hmm. I wasn't there at that time, but looking at the minutes, that's what I concluded.
Yeah, okay.
Through the chair, I was not here, but I was asked to draft the regulations, and that was the current number of permits that Worcester had issued. So there wasn't going to be a scale of reducing them, but we weren't going to allow any more.
Yeah. And so I was wondering too, if you might speak to like your knowledge of other communities and what they're doing with caps. I think it was mentioned before something about Boston having dynamic caps at this point. Are you familiar with sort of any other communities who are doing something more than just saying, here's the number from 2023, including applicants, that's our number forever?
I can speak to my general knowledge of capping. I know the advanced capping is a capping system that was put in place in a lot of municipalities in Massachusetts, where if a permit is returned or revoked, the total cap is then reduced to that number. From my understanding, looking at the minutes of the past couple of years, is that wasn't something the board wanted at the moment, so they instituted the basic cap of 235. Mm-hmm. So that's all I can kind of speak to that. I can look more into that if you wish.
I think that if I remember correctly, I think that the question did come up and of using the kind of reducing cap, and there weren't the votes on the board for that. I was not chair, but I think that there was, you needed 3 votes. I don't think there were 3 votes.
Yeah.
That's, I think, what happened, because there was a draft that was it, but I don't think it became the final thing because of the vote of the board.
I asked that one because to get to the point of like the why behind this, that's not a public health driven why, but maybe like the business communities that had applied at that point, we all settled on 235 being what we have plus what we might have who've applied. So I don't like having that language here because the way this reads to me is almost like 235 is our goal. And our goal isn't to increase the number of permits that we give out to sell tobacco in the city. And it just reads to me like we're going to keep this exemption out there in the world forever until we hit our target of 235, which I don't think is an incentive that I wanted to sort of get behind. I think if I'm reading the tea leaves or through what you just said, there's some permits that are out there that were out there in the past 5 years that are maybe desired to be picked back up after we maybe instituted the cap or after these density regulations were put in place. And if that's the case, it might make sense to allow for retroactive 5 years from today or from whenever these regulations are effective for those permits to be applied for. But I'm not really in favor of keeping open any 5-year duration in the future until we hit our ceiling that anybody could then apply for and kind of gut the whole density debate we just had, which I think is kind of public health driven, and I really want to stand by that. And I don't really want to create a whole exemption process that lives in perpetuity. Does that make sense, what I'm kind of getting at? Retroactive 5 years
Yeah,
from
Doctor,
now.
I understand that, but there's got to be, you have to look at it from two different perspectives, okay? From a public health perspective, which we are looking at, okay? I think this was put in, and you can know better than me, Madam Chair, because I wasn't on the committee back then, okay? In order to maybe encourage some businesses that have permits like this in order to do business, okay? I don't know what difference it would make if we change this exemption or not. I think we should just leave it alone and see what happens.
Well, we are changing it by adding it. So I guess I would ask, what are we hoping to happens? I'm not saying I'm anti-business on this one. I'm asking, I guess, what's the goal here in terms of that business side of things? What are we as a board hoping would happen with this exemption inclusion?
The 5-year piece.
The 5 years.
I guess that whole item B exemption, both the 5-year and the 230, until we reach a 235 cap. I guess my question is, why are we adding this?
Why are we trying for a
I think
235?
To the board, to the chair, I think what would be helpful to your point, and maybe, we can look at this, is it's from the date of inception of this ordinance. If we added the words from the date of when this ordinance to this piece, it might be helpful, but until that 235, but from the date of when the ordinance is actually in place. That way, new businesses that come on, or not new businesses, but as the clock ticks, less and less of those older businesses are eligible to apply for this exemption.
Yeah, and if I alluded to that, and like as effective of this date, I like that idea. If there's some business support that we can give here that is of interest to the city, I think that's reasonable. But I wouldn't let that linger for forever. So I would say, 5 years from effective date of this document would be a reasonable thing to allow. And frankly, I would just take out the whole bit about until we reach the 235 cap and just say, end it with the sentence that ends in 500-foot buffer as, including that effective date. Because what this whole document lives together. So our cap is always 235. We wouldn't be able to go over that.
We are not incentivizing people to apply because we have some spots left.
Yeah, and also it says this shall remain in effect until we hit 235. Upon issuance of the 235th, the provision shall automatically expire. Well, that doesn't make sense. It's like the goal is 235. That's not the goal. And if it happened tomorrow, that wouldn't be necessarily a bit fair to the businesses that might close and want to apply for that permit within that 5-year period. So I'm just wondering, what's our business incentive and what's our public health incentive? I don't understand the business argument, what this accomplishes, but I think if it is to give a little bit of retroactivity, that 5 years is a very reasonable one, and it's not tied to 235, because the whole document ties 235 in already. That is always going to be our cap.
My understanding of this is that it's really saying if you already have a license that is not within the 500 feet, you are okay based on this regulation. And rather than say, now you need to close because you are not between 500 feet. I mean, everyone should be. That's how I understand this. That's why then probably the second sentence I would delete it. But from the second sentence on, then it's really probably what's the intent of this. For me was that if you already have it, you keep it. But other parts in the regulation says that you could transfer or not, then you apply the 500 feet.
I'm not sure whether this says something from the past 5 years could be kept now, or something for the next 5 years. No, just the past 5 years. So if we adopted this, let's just say we adopted on May 1st, anybody who had a license, it's like a little bit more of the grandparenting then. Anybody who had a license for the 5 years before would be able to still reapply at that site.
I believe, just for clarity too, I think the reason why we added the cap, part of the reason why we added the 235 is because we're not trying to add to the cap. So we wanted clarity on only if there is a license available. That's why we said that,
Okay.
So, only if we have room in the cap, that's what the goal was. And also we wanted to set an expiration date because we didn't want it in perpetuity, and that was what was a legally viable way to do it.
So it looks like to me, Kyle, this needs to be rewritten, making those 2 points that Alex just said clearer. One is if there's a license available, and the other is that it's for the previous 5 years from the date that the regulations are adopted. Is that kind of what everybody's?
Yeah. And I think
I'm good on that.
You're good on that?
Yeah.
to clarify, this would be like if I today owned a business at 100 Main Street and I had a permit and then I closed and then you bought that business in a year. This is what we're talking about, right? That Leon would be able to apply for a permit in that location even if it violates some density restriction because that
No.
permit had existed.
But that's already covered. That one is already covered by you sell your business.
No, but like I closed for a year. It's not like I'm selling the permit because I don't own the permit. So I'm not,
Okay.
or forget it that I'm can someone explain what this is saying? Because I guess that is the point. It's not like it's a sale or a transfer. This is like a business comes in and says 5 years ago in 2021, there was a store here that used to sell cigarettes. And I want to buy that location and sell cigarettes, but the guy next door now has a permit and he's selling cigarettes. So right now I can't. This is giving them that ability to do that. Is that right?
Through the chair, yes. This would be a situation, say I'm a developer, I bought a parcel, I had the tobacco permit here through development, COVID, I let it lapse, I didn't renew it. There was a permit there within the previous 5 years from the date of adoption of these regulations that would allow that person to come back and open or, renew that permit at that location. And it would only be as long as there's available permits. So it's not forward facing, it's as of, the date of adoption and back.
And in some ways, it's probably related to what happened with COVID, actually. That there may have been businesses that didn't exist after COVID, and now they've got their feet back on the ground and they want to go back and say, but that was mom and pops, we were always there, can't we just, okay. So,
as I see it, we're giving a little bit to the business community in this one, trying to help out some permittees that could be seeking more density in a place, whereas our public health initiative and goal is to reduce density. So, to the
Yeah,
that
but
point, I
doctor,
kinda feel like
you
this-
got to have a fine line, okay? You can't be just black and white on here. You have to be able to compromise and work with each other. And what I'm hearing from you is just either your way or not no one else's way, okay? You have to compromise, okay? Let's work together on this, okay? And I agree, Board of Health is our main goal, but we also have to try to maintain businesses within the city of Worcester, and I think we should try to work with that.
Maybe you misunderstood what I was saying. That's my point. This is a fig leaf to the business community. We're giving them something in this, and that we're allowing old permits that have lapsed to be applied for. That's my whole point. I'm not objecting to it. I'm just saying like, let's be clear about what we're doing, but it is giving a little bit to one end and, you know, compromising on the other with a time-limited process, and I'm just pointing that fact out.
Okay, thank you for the clarification on that, Doctor.
Okay, so I think we do have some consensus among the board, and you can put it into good words if you would, Kyle.
Yes, I will reflect those changes in the next version.
Okay. Transfer of permits, and this is where the, you know, if you want to sell to Leo tomorrow, your business, that's allowed, right?
Are we still on the same one, or are we moving on to the next one? I'm sorry.
Sorry, I moved.
Oh, okay, so we're moving to the transfer permits. Section F, number 2, letter B specifically. So language was cleaned up regarding transfer of permits. The enforced precedent protocol for when retailers sell their business to someone who wishes to transfer their tobacco permit. Retailers need to be in compliance with the density regulation and any other local and state regulations, as well as pay all outstanding fines. And they also need to inform the Board of Health of their new location within 30 days. So this change was established to make clear expectations for what the retailer needs if they intend to move locations or transfer the tobacco permit to another owner. Previous regulations stated prior written approval from the Board of Health was required. However, this was not enforced, and the precedence of the process that was in place and that has been going on, I think, was sufficient. So that reflects why the change of language there.
I had a question about why you didn't want to know ahead of time, which you just answered. The thing I worry about this is what if you don't accept them in that new spot for whatever reason? So if the new location complies with all the requirements of these regulations, what if the guy thinks it's great, but he's on West Street within 500 feet of Elm Park Community School? He may already have moved there, and you don't know it ahead of time to tell him.
Well, he wouldn't be able to get that permit until he would contact me inquiring about getting a permit there.
Okay.
Yeah, so he would have to go through the state first and then us.
Okay.
Got it. So if they go 2 years at that site, don't sell cigarettes, and then notify you, we're saying it's out of the 30-day window. And so you can't get that permit transferred now. So that's why it's like within 30 days they have to notify the department of the move in order to then get that license at that site.
That situation would very rarely happen just due to
Sure.
the process of how they apply and renew permits. So I'm very much involved in that process from start to finish. So at any point is that once I confirm that that location is available for them to move to, that's when they would start that application process with the state and then through the city. And then once they actually went through the process of applying for that permit and getting the license, that's when I would inform the Board of Health that they move locations.
Got it. Because I had a question, why is the board involved in this at all? This is just a departmental thing.
That's why we wanted to clean up the language a bit too, because it wasn't something that was being done or the board cared for really, and it was more of a thing that we wanted to update the board on a monthly basis. Yeah, you guys are
involved in everything.
That's once you become a board member.
I didn't know that.
Yeah.
You can choose, sorry.
I think the intent of the update was absolutely to inform the board of what's happening.
And reduce any unnecessary hearings.
Right.
And what?
Reduce any unnecessary hearings or meetings that you have to meet with the retailer if they comply with all state and local statutes.
Oh, see, I would be fine just letting you.
Board of Health, or should it say staff to transfer the permit? And do you really want the Board of Health involved in the transfer?
We can include language that indicates that the staff is involved in the transfer permit, but then the Board of Health is notified once that transfer is in place and is.
Through the chair, so the staff, DPH staff is your agent. So when you talk about the Board of Health here, it doesn't mean that they're calling you and saying, can I move to a new location? Okay. They're calling DPH, the staff liaison, the enforcement, authority, and doing all that stuff.
Okay. I mean, I couldn't begin to name where the 235 licenses are, let alone if they move.
Point where they haven't done the due diligence of 30 days, then it will come to the board.
Okay.
Yeah.
Not every single time they move.
Yeah. Oh, I was going to ask that. I'm new. So do you give an update to the board whenever a license is approved? Like a new one?
That hasn't been happening just because it wasn't in the language, but once this was put in place, that can become a part of the monthly updates that Tamara provides as well.
I'm not asking for it. I was just curious what's happening. Frankly, I would say I don't want to know, and I don't care about the transfer as long as they're complying with what we've said of the regulations, and you've done that diligence and whatever you do licensing-wise.
Okay, in lieu of that,
That's me. I don't know what everyone else feels, but I didn't know what the process was for the other stuff. If we're not doing it for new licenses, I don't care about the transfer either, as long as
Yeah,
it's...
I think I'm with Patrick on this. I don't need to know.
Either do I.
To the chair,
Okay.
it's not so much informing the board, it's informing
Public.
the board. They have to inform the Department of Public Health. That's why it's treated the same. Like we're your extension, so they have to inform us.
Okay.
Yes.
Is that what you're saying?
Yes.
Okay, I understand. Okay. Then I love it.
Any other questions on that piece? Okay, the next section is section H, letter A, which discusses the violations. So language was added to incorporate the state fine and suspension framework into the local regulations to provide greater consistency and clarity when doing enforcement. There has been some uncertainty as to whether the Board of Health can establish a standardized suspension schedule or if each violation requires a separate hearing to determine the appropriate suspension period. Based on research and current practice across municipalities, local regulations may establish standard suspension durations, provided that retailers still have the opportunity to request a hearing through the board. Most municipalities follow a consistent structure aligned with the state expectations. So a 3-day suspension for a first violation involving a sale to someone under 21, which is mandatory under state law, 7 days for a second violation, and 30 days for a subsequent violation or third violation. This proposed structure reflects prior Board of Health discussions over the past year, during which concerns were raised that the previously used 5-day suspension for a first violation may have been overly punitive. Establishing a standardized suspension period helps ensure that equitable and consistent enforcement is done while reducing the amount of unnecessary or maybe burdensome hearings that the Board of Health has to succumb to solely determine the amount of suspension days. So under this approach, retailers would continue to receive a written notice of violations and the associated penalties, and that would retain the right to request a hearing with the board within 7 days. Consistent with the retailer testimony, the board would then make a final decision. However, if the violation is not contested, the retailer may accept the penalty, pay the fine, serve the suspension without requiring a formal hearing. And in these cases, the staff can just report violations and enforcement actions to the Board of Health as part of their regular updates.
I got a question.
Yes.
A1, see where it says suspend up to 5 consecutive business days? So determined by the Board of Health. You deleted that, is that correct?
I think that language is reflecting copying the state law over. So I think that's why that language is removed, because in the state law, it doesn't reference the Board of Health just because it's state law. We can add that back in for clarity if you wish.
So let me just give my personal opinion, and anybody can tell me it's a bad idea. What would make it easier for me is if it was not discretionary. If it's 1 day for the first one and 5 days for the second one, and whatever kind of meets the standard that you see in other municipalities, I don't think we want to spend a lot of time saying, well, should it be 3 days or should it be 4 days? Or, it was this way and that way. I would like it to be, I don't want a lot of discretion. But the other piece that it seems to me, if you look at A and you look at C, are we like saying there's state fines and then there's local fines?
Yeah.
So that's hard for me to understand. So I think that there's a way in which when we're giving this out to vendors, we want to say basically for violations, you have crossed 2 lines. You have crossed a state requirement and you have crossed a city requirement. This is the violations for the state requirements, plus this is the violations for the local requirements, because this got confusing for me and I'm not a vendor, so I would imagine it would be for them as well.
Yes.
You want the state and the local to be split clearly?
I think I want it to be very clear that if you have a violation, you are liable for both state and local penalties. This is the state, this is the local. Is that?
And I would support, Madam Chair, on the fact about having a format. First violation, 1 day, second violation, 3, et cetera, a progression, so we don't get into the debate that we did get into before, where I was making motions, okay? If we have it in writing, this is what it is, okay? I think it make it better for the committee, and we can, just move forward a lot more quickly, okay?
Right.
My second question is on the city violation, okay? And maybe this is more a legal perspective. That do we not have to have a fine on that, or could we just go with the state?
Through the chair, so the state doesn't have all the penalties that we have. So, you wouldn't be able to issue a fine for not having their license renewed within 30 days for $1,000. Those are usually related to selling to minors. The local regulations and violations are more for the local. They're not.
No, I guess the question is that what you're saying here, okay, is that, and we'll just use it for example, okay, that the city is going to provide a fine along with the state for a violation, with a tobacco violation. Okay, my question to you is, does the city have to have that fine?
No, and
Okay,
I would
that's
say
all I
that
wanted to bring out.
these
We don't have to what
regulations-
we do.
Yeah, these regulations would not, in addition to the state penalty, be added. These are just for local violations. So if Kyle issues a $1,000 fine for sale to minor, they're not also getting a $400 fine. This is for local regulations.
No, that's, I think if I understand your question is, not all cities and towns in Massachusetts have an additional fine along with the state penalty. Is that right?
That's
Is
correct.
that your question? Yes, and the answer is yes. Not every city or state has it. We have it, we meaning Worcester City has that additional penalty along with the state ones.
Okay.
But
Thank you,
yeah.
Thank you for the clarification on that. I'm just going to leave it there.
Yeah, so, and I'm sorry, just going back to, and just for clarity, is that we don't double fine somebody.
Yeah.
That's the key piece.
Okay.
That's not what's happening. It's this, the state doesn't have as many regulations as we do. So we fine for the regulations that we have on top of, they're separate from the states.
Okay, so there wouldn't be a double one. If you're paying $1,000 to state, that's all. Okay, we should make that clearer.
Yes.
Because I thought you were paying both.
But also, I think this will include then the issue about training the staff. If we are asking them to have the staff sign a document, say, I was trained about the law of selling to minors, then if my establishment is fine because my new staff sold cigarettes to a 20-year-old, then I will be fined $1,000 because of the state law selling to a minor. Then I will get $300 because I didn't have that on file, that document.
Right.
Then my question always was originally is that what are those our regulations that people might violate? And then I think at least I will need clarity which are those kind of, because the other one is clear, is you said someone under 21, but what are the other regulations that pertain, that we establish as the Board of Health? That might need to be clarified, at least for me.
Yes, I agree. I think we can clean up the structured language to be saying these are the state fines and penalties as well as the local fines and penalties. And just to add on to that point, so when I explain this to retailers, I like to give both a copy to the state regulations and then the local. We go through the state one together and I say, these are all the things that you can do wrong, which will get you a state fine and penalty. But when I go through the local regulations, the main issue in that one is cigar pricing minimum. So in the city of Worcester, a single cigar must sell for $2.50, two-pack or more must sell for $5 or more. That's a very common thing that retailers forget or sometimes don't always make sure they're consistent with each brand. So that would be a local violation because that's under our local policy. So that would garner the $300 fine.
And to your point, also the signature thing would be another one of these regulations that may not have been a big ticket item, but it would be something that would fall under item C here. as the local fine for
And-
local violation.
And the way that we're implementing the state structure into our local policy is so that when I go out and I find someone, I can reference our own local policy rather than referencing the state. So that just cleans it up as well as provides clarity to the retailer that they're also very much have to comply with local policy as well as state policy.
To the compromise point earlier, and I think it's worth really pointing this out, this document isn't going to be double fining, but we currently do double fine.
No.
The current $1,000 and that $100
We
is
do not
not
double fine, so the
for
way,
selling to a minor as well?
the way
Interesting.
tobacco control history has worked is, there were national legislations that passed, smoking indoors, whatever they may be, right? Insurance coverage, so on and so forth. As far as retail licensing, all the states developed regulations requiring certain things to happen in every state. Like that was up to the state, Massachusetts, Rhode Island, Connecticut. But because retail is controlled at the local level, they encourage cities and towns. This is like a bare minimum stipulation for all state tobacco vendors. And then every city will be the one enforcing the retail regulations with their own inspectors or coordinators, and they will have the authority to have their own requirements. So we don't double charge at all. What we say to them is, this is the total fine. This is what you are violating, these state regulations, so this is whatever 400, and you're also violating these local regulations, which would be whatever it is. So no double, we can clarify the language, but no double fining is happening.
This document's making it more clear, I think. So you don't need to clarify that part of it. I was misreading the old documents and thinking that we were doing a state and a local fine, which, so that, fair enough, thank you.
We would have had a little more tax levy if we did, but we don't.
What's that?
We would have had a little more tax levy, but we don't.
Well, I was wondering that, yeah, how much it actually made anyways.
Where's
Does it
the
really
pot-
matter?
where's the pot of
What's the
money?
why for that one?
No,
Yeah,
no.
okay, I get it.
It's never a financial incentive, it's more like
So-
protection
Yeah,
and public
yeah.
health, yeah.
So Kyle, we need a little more clarity on that, and we need definitive, 1 day, 5 days, 15
Right.
days, whatever it's gonna be, right?
I agree, yes.
Is this the right time to ask the board to discuss what structure they have? I know standard across multiple municipalities in the state is 3 days for the first offense, 7 days for the second offense, and 30 days for the third offense. Would you like me to reflect that structure in this new version as well? I know 5 days was, I know a lot of discussion was happening in the past year about how 5 days was a little bit too egregious and why we had a lot of conversation about that. So when I referenced other municipalities, a lot of them do 3 days. So I can reflect that
So-
So,
there as well.
but doesn't ours read up to 5 days right now?
Or-
Correct?
The state law says up to 5 days.
Okay,
Yes.
so
So yes, give us 3, 7,
give us
and-
3, okay. I would just consider, I think more than 5 days is a long time for a small business not to be open, okay? So when you're figuring out maybe 2 days, 3 days for the first violation, 5 days on the second, okay? Just be reasonable, okay? Because we've had examples of owners who have made mistakes with employees that just did something wrong that they shouldn't do, and they have to pay the fine. But losing 5 days of business, 6, 7, can be detrimental to a small business. So give us something. I'm willing to work with you on it.
So I think we're saying, for sure, we're thinking 3 for the first violation.
I would rather say 2, okay, for the first
May I make
violation.
a suggestion? This is something we really look at the board to decide, so we can give you some options based on what other states are doing or other cities are doing, and then we would request that if you all want to come up with a reasonable charge, we can help you certainly do
Okay.
whatever is needed.
Yeah, but I think
paperwork-wise.
me and the chair, we want to be able to get this thing settled.
So,
To the
so
chair.
give us what you're going to come back with a draft. So give us what you think is kind of
Standard.
the average kind of thing, and we can rediscuss that. Let me ask my colleagues something here about process. So I'm assuming that we're going to come back to this for another look at the draft.
Right.
Now, we at some point have to do a public hearing, but that's after we've agreed on a draft. Is that accurate?
Can I also, say we advertise it, okay? Can we make changes after we advertise at the we have the
Yes,
public
we have
hearing?
a public, we
All
put
right, and
it,
then
we
we'll
put
get
it,
paid.
we put a draft out there, which is
Right.
what people react to at the public
Correct.
hearing.
Okay, I'm good with that.
Everybody says, "Oh my gosh, that's the craziest thing I ever heard." We can still change it.
Good.
As
That's
based
what
on the
I'm-
public hearing. But I think if I remember from Alex, we do it quickly. So if we have a public hearing and we hear, let's change it, we probably do it that night. Is that accurate?
Through the chair, you could, and then, but if there was a lot of changes, you could say, can you go back, make the changes, come back to the next meeting with a clean draft. I would recommend like voting to advertise tonight, so you have a hearing date, and then if
I'd
you need
support
to extend that hearing date and come back, but I think we have enough information to provide you with a clean draft to advertise, and then you can make changes at the
Okay.
hearing based on public input.
Okay, so are you looking for us to set a hearing date tonight? Okay. So some people in the room are looking for us to set a hearing date tonight. Is the board ready to set a hearing date, or?
I have one more
I'm gonna
change.
say I
It
still
would-
wanted to chat about
Okay.
this a little more if we can.
Okay, so for the suspension structure for the state fines, the next version will match, what other municipalities are doing, and reflect that in the next version. So there's one more piece after this still in section H, but letter C for local fine structure. Language was added to implement an incrementing fine structure for local violations, while current regulations apply a flat rate of a $300 fine. Transitioning to a gradually increasing structure aligns Worcester with other municipalities, such as the city of Boston, and strengthens the deterrent effect. This approach ensures that penalties increase with repeated non-compliance, reinforce accountability, and encouraging corrective action. It also reflects an effort to keep local fines responsive to the current economic landscape and to be more effective in discouraging ongoing violations. And then there's just one more piece that is kind of relevant to the whole section C. It's important to make that determination between the word shall versus may. Using shall ensures consistency by applying penalties, whereas may introduces that discretion and could lead to inconsistent enforcement and penalty and equity concerns. So at that next version, I will also make sure that all of the mays are reflected as shall.
And to the last discussion on the duration, I would recommend to the board that we do for C2, make it 7 consecutive business days, so it reflects the same thing from the previous section that we discussed in A. And I would say for C3, just make it 30 days, so it's the same as what's reflected in A3. And my rationale for that is basically, the first one I'm fine. If they have a cigar for $2.25 and it should be $2.50, all right, just go in, correct the problem, that's fine. But if they're sloppy and having a second one, there's probably more underlying problems, and I want the punishment to be reflective of, kind of uniform, so they can kind of understand what they're getting into. But I don't want to face these same questions at the board of discretion, shall be suspended for up to 7 days, and we have to sit here and talk about it, or up to 15 for this one, but it's 30 for minors. It's messy. I would suggest we make it 3, 7, 30, and make it 7 and 30 for this item as well. That would be my preference to see here.
To the chair, because we're talking about two different types of kind of
Violations.
structures and different offenses in a sense, in that most state offenses are a little bit more egregious, and that we could be looking at a suspension of 7 days to a business for selling like a cigar for the wrong amount. Mm-hmm. So the second time around, so that economic impact to that business for closing for 7 days might not equate, and it could be just a mistake from a different employee. So I think we need to consider that. I do agree for more egregious offenses, certainly, but I think we need to have a discussion on that. Maybe even, and one of the things that I wanted to offer the board was, and we had discussions about this, is to create, along with the board's, working with the board, internal policy document that lines out, what some of these offenses, how do we interpret these offenses, and what are some kind of options that the board has in looking at them. Now, that's not talking about the 3 to 5 to those pieces, but more on these local ordinances that might be less.
Well, one of the things that might be really helpful is just a list. Again, not in here, but a homework cheat sheet that we get before we vote. So the list says, these are state violations, blah, 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 blah. These are local violations. And if it really comes down to the local violations being the wrong price for cigars or something like that, we're going to be very comfortable saying that the penalty should be much less. But if it's a mixed bag, that's a really different thing. So if we could have a list of what were state and what were local, that would probably help us feel comfortable with that vote.
Okay.
My only thing is that if using the local regulation, it goes together with the state violation of regulation. Then for the state, currently it says here is up to 5 days, and then if the local penalty is the first, it might be different, or the second might be different. Then it's probably that there is a clarification that probably the two suspensions are happening at the same time, rather than I have 2 days for the state and now I need to do 7 for the local. Then I think that there is some consistency that the two of them are kind of merged, if possible. The suspension I'm talking about.
To the board, I'd like to point to our city solicitor for clarity on concurrent suspension. Is that what we do? I'm unaware, so it'd be good for clarification on whether we assign both suspensions under the state and the local.
Through the chair, I don't think that you've assigned any local suspensions, right? I think that when the violation comes to you, you've taken it as a whole and said 3 days, 5 days.
We don't know it, that it's different.
So I would say that you still treat it as one, and okay, here's your mandatory 2 for the state and 2 for local, 4 days together. I guess you can decide if you want it to be concurrent or not. I don't think you'll get a lot of violations of local regulations without state. That's the thing, right?
They're pretty intertwined.
Yeah.
Parallel.
So if you're doing compliance check and someone sells to a minor, then you go in and you start asking, oh, where's your certifications for your regulate? Then you say, well, here's $400 for the local violation and you're going to get an extra day. I don't think the enforcement officers are going to go in and say, where's your regulations when there's been no violation. So it's usually going to be the state penalty, state violation, in addition to then, oh, we're finding that you haven't been keeping your records, you're not training your employees, you're not complying with the regs.
And in practice, what we've done is relied on the staff. So they went in and they knew there were 4 things, and they would say to us, there's 4 things, and we're suggesting a fine of X, which has already been out there, and, 4 days or whatever, yeah. So we could also go back to that practice too, that staff is figuring that out.
I would say you can always have recommendation of staff, but in addition to your regulations, yeah.
I just wanted some clarification. So I know we talked about a few minutes ago that if someone were to have a state violation, they would just be charged that one fine because it's now under our current regulations. So why would we not stack the fine, but we would stack the penalty? So I feel like it might be worth being consistent with both. So if they were to have an egregious sale to a minor and it's their second offense and they're 7 days in here, I think that would just serve a 7-day suspension. But that could coincide with serving the local suspension as well if I were to find local violations as well. So again, I'm not the decision-making body, so I would just ask the board to consider both of those as well.
Yeah, I think it's getting late. We're all getting a little confused. But yes, I think that we're agreed on you shouldn't be hit twice. But you probably need to make the vendor aware that they've checked 2 boxes. Yes. Yeah, or 5 boxes.
The way the state works, you would get hit twice, right? Like if you found 2 state violations in one visit, you get hit for violation 1 and 2. That would be falling under the second. Is that right?
We don't do that type of enforcement because selling to a minor, we don't want to endanger the minor anymore by asking them to ask for an illegal product. So those are kept very separate. Whenever we do an inspection where we suspect someone is selling flavored products, I work with WPD, and they send someone in themselves. So those things are kept separate for a reason. So no, we don't do that.
But what if you did find it? I'm not saying we're not checking for it, but what if you did find? What if they sold the kid a flavored cigarette?
That just
What would
hasn't
you
been the enforcement that I've done so far, or have been trained or been told to do it.
State lay it out though as two separate offenses. Like each.
Through the chair,
'cause
I
they
mean, I don't think so. I think it would be, this is like your first violation, and it includes violation of all these regulations. So you would get first time and a list of every rule that, was violated. And then the second time.
And that's how it comes to us. When you
So
would say, this is the first violation, they did these three things
But then
wrong.
the language might need to be changed though, because it's specific about selling to people under the age of 21. Then probably should say, in the case of the first state violation, this is the fine, regardless what violation is. Because but the language here is just for 21 though. Then I think it should be that in all of them is that if you violate the state regulation or the state law, your first one is $1,000 and whatever days suspension. The second is 2,000 and whatever days, and the third is 5,000 and whatever days. Then is any state regulation,
That
I
makes more
believe so.
sense.
Yeah, rather than, because here, if I'm selling flavored cigarettes, there's nothing here that says that I need to be fined in this regulation, but the law says that I need to. But again, the regulation should be in alliance.
So the
with-
regulation would, but we wouldn't then suspend them actually.
Probably. Then
That's how
again-
this reads.
Yeah, but again, I think I would say
What
just,
you're arguing for then would be to do both the fine and the suspension for any violation of the state.
of the state, yeah.
Yeah. I think
So-
that would be simpler.
That
as
is
a business.
Alexander can speak to this too. I believe that is something that you can implement. However, when I speak to state tobacco advisors, they often are very clear about there's no suspension of the first violation unless it's a sale to the minor. So I can look into why exactly they stipulate that and let the board know maybe there's some reasoning behind that. But I believe the board could institute a penalty for a first. They could institute a suspension for a first penalty of a state violation if they wanted to.
So what's written here is kind of your standard practice, is what you're saying, of the state. Yeah, okay.
Correct.
Yes.
But you as the board are
Yeah,
allowed
it is
to
confusing, yeah.
expand on those requirements and add a suspension if you want.
As far as the gestalt goes, if the practice of the state would be, you have 3 offenses, it all counts as one violation, I'd kind of be on board with, as a board, rolling in all of our local violations into that one offense and one punishment in that one time. So if you got caught doing something on the state level that was a violation, but we also found you had $1.50 cigars, lumping that into one punishment, if that's what the state would be doing, I think that's a reasonable policy to carry forward.
Yeah, as long as we're not asking you to pay a separate fine, there's no reason not to do that. I mean, if you were being held for the state stuff and the local stuff separately, but we're not.
In the past, I have seen citations. I'm not saying exactly why they're written, but a citation of $1,000 and it's been a long night. $1,300 because they violated both a state law plus a local ordinance. So one citation has the explanation of what laws they violated and including a lump total of the fine.
I think if the board would be amenable, just in listening to what Dr. Lowe and the other members have said, is that maybe the idea is that the fine structure remains as is, you fine them for the local and the state, but that maybe the suspension is the piece that you put it all together for that one. And that could be kind of the middle of the road. Let's do one suspension for these instead of lumping them up into different ones.
When you say one suspension, be like, you're kind of serving them simultaneously, not consecutively.
Right. So it's cleaner. And then we can keep the fine structure because they're 2 separate kind of pieces, the state and the local.
So
that
are you
could
saying
be-
that at the first violation, there would possibly be a suspension? Is that what you're saying?
What I'm saying is that instead of them being suspended for both a state and a local,
Right.
we just do one suspension instead of adding more days.
Because they're going to get suspended anyways, either through the
Right.
state or the city.
So they can
Right.
serve both suspensions concurrently instead of doing them consecutively. And now you're, same thing, now you're adding 5 days and another 5 days, you have 10 days for one first offense or
okay.
something. It doesn't, it's not equitable, I don't think.
So I would suggest then that in C, we make those suspension determinations and just decide this like a number. Because this goes back to that problem before of like, we're gonna be presented with up to 7 days. I get your
Right.
point. It's like kind of, it's certainly not the big ticket items. It's not selling to minors. It's not selling flavored cigarettes. It's like $1.50 cigar, maybe 3 days, but no, as determined by the board, no ambiguity of up to 7 days. Maybe we just pick something to put there, and it could be 3 and 7, which would kind of mirror the prior item then.
So,
Or states, well, we would still say you're suspended for this days but we'd say you serve it concurrently or something like that.
so I think we're asking Kyle for you to come back to us with some suggestions based on what you know, based on what the state says, based on what other people are doing.
Correct. Just for clarity, for the local fine structure, we're still not having a first offense penalty, but the second offense, are we changing it from 7 to 3, and then the third offense from 30 to 7, or are we keeping the the 7 and the 15?
If we want to take it up, I say 0 days, 3 days, and 7 days, without a hearing and without up to in the language. But that was my thought. No
Yeah,
one else
let's
mentioned anything from the
start
board.
with that. We want to bring the days down. This is too high.
Will do.
So are we finished? Is there anything on F that we don't agree
Well,
with?
To the chair, I think it is really just looking at what the next steps would be, and that potentially, we could vote to.
So here's my issue. If we vote today on a public hearing and start to advertise it, people will say, well, what are we talking about? And we don't have a what we are talking about because we need the draft finalized first. So I appreciate that it would be helpful in terms of the advertising to get the date out. But as soon as you get a date out, people are going to say, well, what are the changes? And we're not finalized on this. So somebody correct me if I'm thinking about this wrong, but I think we have to have the next draft and us be at least comfortable with the draft before we can advertise. Does somebody see it differently than that?
To the chair, I just want to ask some clarifying question from the city solicitor, and that is, when we post for advertising, let's say we vote for advertising, would we vote to advertise the current, or would we vote to advertise a new draft with the comments that, because we can vote to advertise based on the comments you have made tonight?
Just that there were a lot of comments made tonight.
I think we need to look at it.
Got it.
Let's have a meeting on it.
Yeah.
Okay.
So if I may, through the chair, if I may just repeat, just so we all are clear. The board prefers to meet one more time to look at the final draft with the changes that they have recommended today, after which they would plan to vote, or they would advertise to vote.
Right.
I think that's
Okay.
accurate.
I'm
Thank you.
on
Yes.
board with that.
Okay, so the next meeting, maybe it's the 4th, something like that?
41 years. It's my anniversary. It's fine.
Okay. Celebrate on Sunday.
Okay. I'll tell that to my wife. I'll send her yellow roses.
No,
You
no.
here?
Take her away for the weekend. How about that?
No,
Is-
bring her here.
Is it possible
yeah,
for the
right.
board to meet before, just to
Yeah,
review the
we could do
revised
that.
draft?
I think that would be reasonable.
Or do we have to wait for the month?
I'm away on both the 20th and the 27th. So if we could do it on a
We'll do
week
it on the
from
13th.
now, on the 13th, that's pretty quick.
Well, what do you mean? Meet on the 13th?
Next
That's
Monday.
what
We are
Sina is
asking.
suggesting.
We are asking.
I'm traveling.
I would be game to do this sooner than a month, because then we're just doing another public meeting a month into June, and then let's get it done.
Is that, can everybody meet?
I can't.
You can't? Okay.
and I can't after that.
Yes, so 2 board members can't
Okay.
meet, okay?
So it's going to be on the 4th of
May,
May.
May.
okay.
And then probably we would do the public hearing possibly sooner than a whole month out, but we would do it fairly quickly,
We're doing it on Monday again?
depending on people's schedules. I mean, we usually do Mondays, but I think we,
Do we wanna-
May 4th for the next meeting, and then probably June
Should-
8th or 1st.
Or
it-
or should
well,
we just look at May now and see, like, does the 11th potentially work? How long do we need to give notice for a public meeting? A week could be enough. Yeah.
So what,
So would you like to schedule a public hearing in June?
I wouldn't say schedule, but maybe we could all block our calendars for something. I'm saying in May. Can we look on May 11th or May
Yeah,
18th?
for public
or-
hearing.
so
The
I would
first
say
Monday in June, okay? I'm available.
that is the 1st of June.
Yeah.
Okay, so we are looking at the next meeting, May 4th, and then
Right.
May 1st for the public hearing.
Right.
And what we usually have done with the public hearing is we have the public hearing, but then we meet. I mean, we have some work to do after everybody talks.
We're going to meet here at the public hearing, or will we go to a bigger space?
In the past, we've met in this room.
Okay.
I don't know if we think we need a bigger space.
Madam Chair, you've been on the committee a lot longer than I've been, so you tell me. I mean, there's other rooms available, so.
May I just recommend that maybe that, I know that we set the 4th, but if there is a need for a bigger space, that we think about being flexible with the date and looking at bigger spaces if available.
Okay,
The 4th is supposed to be this meeting, right?
Yeah, that's
Yes.
just the board, right?
yeah, it's June 1st that we're looking at as the public hearing day. And if you can get us, I mean, put us wherever you think it makes sense from what you're hearing. So Kyle might get some feedback, you certainly, Alex, might get some feedback. We don't mind going to a different room. If, so. But we're looking at the June 1st for the public hearing.
And then we should book a meeting not the Monday after July 4th to approve it afterwards, maybe?
So,
Try to get it in before then?
I think that unless something changes, what frequently happens is we have a public hearing and then we vote
Right.
Oh, okay. That night.
that night,
Yeah,
even if there's minor changes.
yeah, you would vote the changes in. You would vote on the regulation as, as a
And that would be in a pretty formal way. I mean, someone would make a motion, it would be seconded, we would probably vote on the motion before we voted on all the regs. Does that make sense?
Yeah.
Okay.
But we would expect to finish that on June 1st, unless there was something very big. Am I right about that being the process usually?
And I am hoping on the 4th that we have consensus on everything before we go to that public hearing.
Yeah.
Okay,
Yeah.
all right.
And I believe the board would also just have to keep in mind an date of effect that it takes place as well, not just the day that it's signed.
Right, there is a motion, there would be a motion that we approved effective on such and such a time. And usually, it's like the next month or something. I mean, we don't have to wait 6 months, but it might be July 1st or something like that. Yeah. Okay, going back to the agenda, Tamara, do you want to tell us what's in the director's report? I think you can make it very brief. We've had a chance to look at your
I have to be somewhere soon.
information.
Yes, sure, Madam Chair. I'll just highlight a few achievements and get us all out of here for the evening. So WDPH, we participated as one of the 5 municipalities to pilot the SAFE 2.0 Performance Standards Survey, which we've successfully completed. We have our Black Maternal Health Week coming up that we're hosting a number of events that week, starting the week of April 13th. And then the Greater Health of Worcester annual meeting at the Worcester Public Library will be participating and supporting that as well. The team did host a WDPH Shark Tank event about 2 months ago now at this point, where staff were able to share innovative ideas to monetize existing or new services, strategies to enhance, diversify, and sustain current funding opportunities, and creative solutions to help DPH operate more efficiently, collaboratively, and entrepreneurially. So a big shout out to Tim McGurthy, the CFO of the City of Worcester, Erin Taylor, Budget Director of the City of Worcester, and Kevin Levancy, Chief Equity Officer, who actually served as our sharks for that day, and two of our staff, Irene and Alta, who helped put together some great presentations. That concludes the presentation.
Tamara, can you tell us if we wanted to go to the Chenal Greater Worcester Healthy Annual Meeting, what time is that at the library?
Sure.
12 to 2 tomorrow. Thank you. Okay, back to the agenda. Is there anything else that we need to talk about today, or can we look for a motion to adjourn?
Motion to adjourn, Madam Chair.
Second.
Okay, Mike. Thank you, Patrick. All in favor? Leo?
Leo Negron Cruz, yes.
Patrick?
Yes.
Mike?
Michael Parado, yes.
Francis Anthony's yes. Okay. Thank you very much. I know this was a long meeting. Got a lot done. And again, the agenda for the next meeting will be finishing this up when we get the draft back.
Let's go UConn.